Face it, even when things are good, nobody looks forward to going to the dentist. It's like pulling teeth to get me to make an appointment. And now with the new coronavirus, there are even more concerns. You and the dentist or hygienist are in pretty close proximity. We know the virus is spread by droplets, and well, there's no other way to put it. They're working on your mouth, and there are droplets flying all over the place. So what safety protocols are being put in place? My buddy, Dr. Keith Blankenship, a dentist and soon to be practicing orthodontist, joins me here on The Morning Show. Everybody's got concerns, the patient, the staff, and the American Dental Association's moving forward to take precautions. So when we sit in the dentist chair, what safety measures are there, Keith?
Good morning, Bruce. Good to talk to you. The CDC, OSHA, and the ADA together, they have pretty much similar protocols. But when you're going to the dentist office, you want to make sure that you are in contact with the dentist before you get there, because most offices are going to have you waiting your car before you actually go into the office. That way, there's no overload in the waiting room. There's very limited space in the waiting room. Wear a mask. They're going to do a pre-screening before you go in. Most likely check your temperature, that it's going to be under 100.4 degrees Fahrenheit. Ask you some simple questions. Do you have any cough, fever, shortness of breath, chills, headache, pain, sore throat, loss of taste or smell? Some of the basic questions that you've been hearing on the news lately. And you also may have the option to defer treatment till later. If it's not an emergent treatment or urgent treatment, or a treatment that you don't feel that is need, or the dentist doesn't feel that you need right away, it may be delayed for a period of time, whether that's a couple of weeks to a couple of months. They'll let you know if it will change the outcome or not.
Okay, so I was going to ask you about
yes.
that. Say you've got a filling that's really bothering you, or a root canal needs taken care of. Should you get that done?
Absolutely. No doubt about it. The offices are set up. I talked to my rep, Lydia Hines from Patterson Dental, and they have made sure that, and they're continually make sure that all of their offices are set up with all the proper protocol, the N95 masks, they have to have a plastic face shield, gowns, gloves. They have to have a certain protocol to actually protect themselves as well as the patients. So you're in good shape. The aerosols created in the operatories are cleaned with hospital-grade disinfectants. There is a real strict protocol going on within the offices as guided by OSHA and the CDC and the ADA right now.
How about some of the more invasive procedures like periodontal, or if you're dealing with gum disease? Are they some of the things that you're saying maybe you should hold off and wait a little bit?
It depends, again, on the severity of the disease. And if you're going to see the specialist, the periodontist, the office will actually tell you whether you should come in or not. Those type of periodontal issues can be just as bad as a root canal or anything else. It all depends on the severity of the disease itself. Periodontal disease, as you know, is a very prominent disease, and it's something that really needs to be under control in everyone's mouth. That can affect your overall health as well.
Right, because it can lead to heart issues.
That's right.
Kids and the orthodontist.
Okay.
If it's just a basic checkup on the braces, maybe an adjustment, things like that, should we be taking the kids in?
Yes, so that's a good question. I was going to come to that shortly, so I'm glad you actually asked that. An orthodontist office actually has high volume patients. There are a lot of patients that come in there. So yes, you can definitely take your kids to the orthodontist. The orthodontist office typically doesn't create aerosols in the air, so the chance of spreading in there are far less than a regular office that are creating aerosols. But please remember, you may be asked to wait in the car while your child's in the treatment room. You may be asked to call ahead of time, and when your chair is actually ready for your child or yourself, then you're going to be asked to come into the office at that time, things like that. So be prepared. Be prepared to not go back to the back with your child or family member or friend. It's going to be a very limited type of seating in the waiting room, for sure.
And as strange as it sounds, a lot of dentists are doing pre-screenings using, the telemedicine
That's right.
applications.
I was talking to my good friend, Melissa Nixon at Jacksonville Family Dentistry, who I'm affiliated with, and they're actually doing all their screenings ahead of time. They put a big announcement out ahead of time to all their patients, explaining the procedures, and it's actually very well done. It goes right by the OSHA and CDC guidelines, and pretty much the telemedicine is going to actually, I think, change dentistry a little bit. Medicine for sure. I think the telemedicine is going to be a thing of the now, not the future.
Dr. Keith
sure.
Blankenship. Last but not least, April's going to let you keep that beard?
This is my COVID response, non-COVID, COVID response of being at home all the time.
All right, so that means when this is over, that's a no. Dr. Keith Blankenship, thanks.
Pretty much. Thank you, sir.
7